Hello, everyone. So it seems like we are live. I hope everyone can see and hear us. If yes, just write a plus in the chat so that we can make sure that we are really online and nothing technical happened in between. So I can hear myself. Do you guys hear me as well? Say something. At least you guys hearing me. That's good.
I hear you.
Okay,
cool. I hear you.
Yes, the plus dropping in.
Yes, nice. All right. Lots of pluses. I like this one. So hello, everyone. It's good to see you again after this summer break. I must say the weather in Munich is really shitty. So I don't know how it is in Augsburg, Tony, but here it's raining. And I'm really happy to be here, have the morning coffee, or in my case, water. And maybe a quick question, guys. So who has been here before? If you have been here before, just write a yes in the chat so that we know how many, can you say that? Wiederkehrende Teilnehmer we have. Guys, repetitives. Yeah, perfect. Okay, so I mean, I don't need to introduce myself like a lot. I'm Natalia. I'm the founder of FitTech Summit, and also of the FitTech Society Series, which you are part of right now. This webinar is devoted to data and use of data for adapted physical activity, rehab, prehab, and we are hosting together with Garmin. We have also Juha from Garmin, who is going to tell us a lot. Who's going to tell us a lot of things about wearables and use of data for that. And maybe before we get started, of course, we want to know where you guys come from. So please feel free. When you're talking, the sun is shining. Oh, that warms my heart. You can also just post, hearts in the chat. I will not object to that. So let us know where you come from. I just saw Berlin, Latvia, Belarus. Hi, Belarus. I saw France somewhere as well. So just let's interact here because you can see us, we can see you, but we can listen to you. Munich is here, of course. Hey, Munich. If you guys have any questions, this is a standard procedure here. Please do not post them in the chat. Barcelona, buenos dias. Sweden, I don't know how to say hello in Swedish, sorry. So if you have questions, guys, you see the tab Ask a Question below down the screen, okay? Japan, really? Arigato, that's all. Okay, and you can upvote the questions. I will try to integrate these questions in the discussion. Cambridge is here as well. Hi, Zurich, perfect. So please do ask the questions in the Ask a Question tab. All right, so I would say let's get started with a short introduction round from our speakers. And Shari, why don't you get started? Tell us who you are, what you do, what your company does.
Yes, hi. Nice to meet everyone. I'm actually very surprised, like how international this crowd actually is. So yeah, my name is Shari. I'm a medical doctor by training, but I'm working like at the intersection of digital and healthcare for the past 10 years now, I think. And for more than 3 years, I'm working for a clinic, or the holding of the clinic based in Switzerland. And my main goal is like to digitize rehabilitation for stroke patients. And while during the first years, I was mainly working with the researchers there in the clinic itself. We now have our own little startup based in Berlin that is focusing on bringing rehabilitation to everybody's home. Somehow, like the connection between telemedicine and the sensors and devices. So yeah, that's our big goal.
Very cool. Thank you. Welcome, Shari. Juha, how about you? You're from Garmin, you're from Munich. Tell us more. You're mute.
And now?
Yeah.
Excellent. I'm from Finland, so I don't like to talk, so that's why I'm muting myself all the time. So sorry about that. And by the way, god morgon, it's in Swedish, good morning.
Good morning.
So, Juha, based in Munich, And yes, I work for Garmin, and I have been working for Garmin Health for almost 4 years. And within that role, basically, my task and our task in a team was to help third parties, startups, digital platforms, research institutions, health management organizations to integrate our wearables and the data into different kinds of health or wellness related settings. Currently, I'm working in a bit different role also, but Garmin Health is still a topic. But I work more in a regional basis in emerging markets, which is basically East Europe and Middle East, Central Asia. But still, this health, fitness, and data is an important topic also in these markets.
Okay, cool. Welcome, Juha.
Thank you.
You are marathon runner, apart from all other things.
Yes, I'm Jan. I'm an active sportsman since the cradle, I would say, and since after my school career, I started a scientific career at the Technical University Munich. I studied there, became a PhD now, and more or less my whole life and my whole scientific career circles around physical activity. I think physical activity is very important to teach it or to make the people move from the beginning. And we do many research in terms of children with chronic diseases, congenital heart disease, children with cancer. And nevertheless, we also look on adults and try to figure out how they move in our, these wearables, and the digital approach will become a more and more important focus for us to see or to develop approaches to make those people moving.
Okay, so welcome, Jan. Welcome, all of you. Let's get started with a data question, data 101, I would say. So in terms of rehab and prehab and general physical activity, not specifically for professional sports, what's the state of data usage right now that you guys see in your work?
I think this is for Jan.
Go for it, Jan.
It is definitely. The data I'm working with, I mean, it's very versatile. I mean, it's difficult because you can get so much data and you have to condense it a little bit to make valid research out of it. For example, it's quite simple, and I think through years of research, many parameters and many data occurred, but still we are relying, for example, on body weight, on blood pressure, on simple measures. And one simple measure, for example, we are using are simply the steps you are doing throughout the day. Don't care about when are you doing them, with intensity you are doing the steps, are you running, are you sitting? I mean, it is great to have all those information, but then you have to process the data, which is sometimes very difficult, but very often it is easy to rely on simply easy data you get from your patients or from the people.
A stupid question. What's so bad about simple data points?
Nothing at all. Simple. In research, you very often say, keep it smart and sexy. KISS. Keep it smart and sexy. And this is very often true because sometimes it seems a little bit you just develop data for research purpose that don't have any clinical measure. And this is a little bit frustrating, but I mean, at the end, it is important to give your patient a simple idea what they can do. The steps to 10,000 a day, and not be active maybe half an hour at this intensity level with a kind of this and that, because that it makes it difficult. A simple message is what I think a big advantage if you can generate this. A simple message you can tell the people.
Okay, Jan, I guess you need to check your mic because you kind of, keep disappearing. Maybe you could just use the headphones. That might be better for us.
Yeah.
Okay, that's just that you know. But Shari, what about you? You're working with in rehab quite a lot, and you are seeing lots of usage of data for patients, but also for the healthcare sector. So what's the current state of the art of data, and where is this journey taking us in the future?
Yeah, quite the opposite, I'd say, from what we heard before. We don't have a lot of data, to be honest. In stroke rehab, I must say. I think in other rehabilitation units, it might be different. But if you keep in mind what our patients usually look like, it's elderly people who still need to get used to devices. While I'm not saying it's impossible, I'm actually thinking it's very possible if you think like the uptake of the iPad, for example, among elderly users. I think it's just as likely that they pick up sensors. But still, we usually do a lot of stuff without actually looking at what we are doing and what's best for the patients. So what we really need to do, especially in stroke rehabilitation, is measure what we're doing and then come to conclusions and decide what treatment works best for each and every patient. So aligning progress based on data with personal goals, because every patient might have different goals for his stroke rehabilitation. So yeah, we really have a big lack of data there.
Okay, so data has to be collected somehow. Juha, can you tell us more what kind of data points you can collect already with your wearables, and how this could be used in medical setting?
Yeah, maybe I add from what both Jan and Shari said, both from the sports environment, and the patient monitoring environment. What we can see, it's a bit further already as steps and everything, and obviously as Garmin we have both the wearables and the data in it. From the sports environment, I can say that if you take a professional football team, for instance, or any other top athlete team, their metrics or requirements are different perhaps than they would be in a stroke patient or any other cardiac patient. But what we try to do is that because the top athletes are, for instance, they are fully equipped with all types of sensors, and they during the training they are be measured in real time. But how these teams have started to use a Garmin wearable or any kind of a wearable is that they try to combine the all-day data from stress and sleep, and on top of these, let's say, purely physical activity related measures there, because then the research and the trainers can get much more, let's say, a holistic picture of where they are. And that's actually the same with what Shari said, that the elderly people, for instance, physical activity, perhaps the exercises they would need to do if they are able to do that. How are they sleeping? Perhaps how is their resting heart rate developing? And so that's even relevant for those patients as they would be for top athletes. But how to get that data to them and to get to them to use a wearable or other kind of a mechanism, it's the challenge. But from the experience, I can just say, on top of all of the physical activity metrics, our wearables can measure sleep, stress, body battery, pulse ox, are examples of data that are combined in different settings in the top athletes and in the patient monitoring segment.
So what is more important? Is it more important just to measure precise data, or is it more important to combine it in a meaningful way and see what happens for different target audiences?
Well, I would say it's a combination. It's my opinion, but because if depending on how able the user, if it's a patient or a normal just a standard person or a top athlete, there's a huge amount of data, but I think the combination of data to be contextual and adaptable and actionable is the key here. And we have lots of things to do just to make it relevant for that certain person.
Contextual, adaptable, and actionable. I think that's very good. These are very good keynotes. Shari, what do you think? Where can data... Oh, to be more precise, how can data become actionable in patient care?
Yeah, I'd actually like to add first to the first point.
Sure.
So in rehab, I think we are still so far behind in terms of data that right now it would even be very useful just to collect precise data and then put meaning into it later, because our study populations are very different, basically. Like every stroke patient has very different deficits. So we need huge study populations to actually put meaning into it later. So right now, for me, the main goal wouldn't even be to put meaning in it already, just collecting the data now so that we can use it later on. But sorry, I forgot your question before now.
Never mind. I have a different question now, because you said it's difficult to collect the data. So how, like, to be really precise, how can data be actually collected? What's possible there? What's now and what's possible?
Oh, I mean, there are plenty of sensors on the market already. The only problem is that most of them are still in a research stage. And they have to be at a research state because our data needs to be very precise. So it's what we were talking about before, like only counting the steps wouldn't help in rehab much, apart from that we know the motivation of the patient, right? So if somebody takes more steps, it's better because he's more motivated to get better. However, we need to precisely measure how they're taking these steps, how they dealing with the deficits they have, and if they're really training according to their deficits, using the arm that has a functional deficit, for example. So we need very precise sensors, and we need very precise analytics as well. So there are plenty of sensors on the market, but then we have the problem, sensors that are still at a research state aren't very attractive to patients, right? So they can be big, they can be bothersome, and patients then are not very likely to use it in their home setting. If, for example, the best example in stroke is actually most of the time you need two sensors to compare sides, because they have one side that's inhibited and one side that's functioning, and you can only tell what's going on in the patient if you combine two sensors. But who wants to wear two wristbands or two sensors at the legs or sensors all over the place? So this for me is the biggest challenge, and this is what actually keeps me up thinking about what can we do in the future, because we can have the fanciest sensor in the world, but if the patient doesn't want to use it, it doesn't help us at all.
Juha, what do you say to this?
Yes, I agree and disagree. But you are talking about now medical grade devices as such, medical grade sensors, which is fully understandable, and that's Garmin and our beloved competitions also. We are manufacturers of consumer wearables and consumer electronics, but as I mentioned already, how to combine data for a purpose and a context. It relates also to wearables or sensors, because if you need to track a very sick person all the time, as said, you have to have a very accurate sensor at his hand or so. But then there are moments that you have to complement that medical grade sensor with the consumer wearable, because at least I believe that, for instance, Garmin wearables are very nice looking measures, and people want to wear them, and actually you get a lot of complementary data from them for the medical purpose as well. And that's what we do a lot in cardiac patient rehabilitation, for instance, because the people have to wear them 24 hours, and they like to wear them because there's a benefit for themselves if they are in that stage that they are still in the middle of the life, not like in after stroke perhaps. But I see both in data and these sensors and wearables, the combination of that, because to get the whole day data from the person and then the punctual medical grade data is a key, I would say.
Yeah, we got a couple of questions. And Jan, you want to ask?
Can I quickly, I already noted the difference between Shari's and my research. I mean, she has into movement science more, where this is very necessary that you have sensor activity where you can measure the movement and the posture and all those things. For me, from the cardiovascular research, I'm with Juha. These new wearables, and independently, is it Garmin or Fitbit or whatever, the people want to wear them. The people want to wear them. And we had in our research years ago, when I made my PhD 10 years ago, we had the problem that these activity sensors were worn on the wrist. They were really ugly. They looked like you were asked what you are wearing there, and it always was like a stain. You were sick, you are doing it for research purpose, maybe you have an issue. Now you can give him those wearables and everything seems to be fine. It's not kind of a stain, and this is very important. And also for the kids, don't want to advertise Garmin here, but the VivoFit Junior, we give it to children with the age of 5 with a frozen Captain America design. They are nuts on that, and they really like to wear it, and we get very important data, which was definitely not possible before, because there wasn't any device, and the compliance with those wrist-worn wearables honestly was very bad. So for us, wearable technology is a big asset for research from the cardiovascular perspective.
What I hear you saying, everybody wants to look good, independently of whether they are patients, athletes, or just kids. So this coolness factor shouldn't be underestimated when doing also rehabilitation research and so on and so forth. We have a very good question, which I would like to ask to 3 of you. So the question is, what are the 5 most important data points you need for making suggestions for the many people? Asks Tony from Augsburg. And I would say, maybe Juha, what are the 5 most important data points for athletes on the sports side?
Well, I would give 2 as an example that are both relevant for top athletes and maybe patients in prevention or rehabilitation. I think VO2 max and sleep are things that I can see be repeatedly used in both. Obviously, because our wearables are using obviously everything to physical activity, distance, speed, your heart rate, and everything. But the relevance of, for instance, VO2 max for a top athlete and a cardiac patient is relevant, and then a sleep phases, quality, and the reasons for why it's bad or not, because the sleep is a very important factor in terms of recovery for a top athlete.
What would you measure in sleep exactly?
Sorry?
What would be the most important data point for sleep measurements for you?
Sleep quality. Basically, sleep quality, the amount of sleep and the sleep quality. And because for the top athlete, that enables him to train as hard as yesterday, tomorrow. And for a person, for instance, being a risk group for obesity or something like that, then or managing stress, for instance, with a good sleep, you are able to implement your behavioral change easier. But yeah, I would say from the top 5, I would list 100 of them, but these are the 2, VO2 max and sleep, are very important, that are both relevant for top athletes and patient groups.
Well, I definitely need more sleep. Also, I'm not an active athlete or professional athlete. So, Shari, what about the rehabilitation patients? Do you think that VO2 max and sleep are also 2 most important data points, or how do you see that?
No, I don't think so. However, it's a difficult question for me, because stroke rehab has so many different points that are important. So on the very simple side of things, I would track if somebody uses his or her affected arm or leg at all. On the more precise side of things, I would like to track how they use it and how they execute the movements. And there it gets very complicated. And this was actually the thing I was mentioning before, just to agree on this again. I think in cardiac rehabilitation, sensors are already great. Just in stroke, it's super difficult. And to be honest, it's super scientific, and I don't even know what the exact data points would be for these types of movements that we need to track.
Yeah. Jan, you want to say something?
My 5 points.
You can just start with 2.
Just with 2. I agree in terms of mortality and morbidity. We also measure VO2 max, peak oxygen uptake, with a cardiopulmonary exercise test, which is also for young children already important to, especially those with chronic diseases. VO2 max is a bit important parameter how they will hospitalized in the future and mortality outcome. Another point is heart rate variability, which refers a little bit kind of recovery or sleeping quality, which is with these chest straps very good to measure. So it's very good parameter to see, are you stressed or are you in a relaxed state? So heart rate variability becomes more and more important, even if it's a measure that is very varying, so has a high standard deviation, which could be difficult to interpret, and you need a huge data amount of.
Oops, Jan is away. While we're waiting for him to reconnect, I have another question here from Benoit, and this is, can you tell us how you collect data from elderly persons? Because they're not digital natives and don't have a lot of device trackers. If you have data that you can tell us is the impact of, what is APA actually? I don't know. You know, guys, know what APA is?
APA or API?
APA. Maybe he just meant API. Anyways, so the question is how to collect data from elderly person. We kind of touched a bit on it already, but is there anything you would like to add to that?
Maybe I add some just in a generic issue. Stroke rehabilitation is very, very difficult. Very difficult. I would say we would be more relevant in the prevention stage of that, perhaps, rather than, unfortunately, I'm very aware of stroke and rehabilitation from my own family background. So that's a very different. But prevention would be in general, elderly people. We are engaged with several medical studies, clinical studies, and programs with elderly people of different kinds of reasons. And typically, if they are not, quite often they are not digital natives, but in that case, it's just possible to have a wearable in their wrist, which could be black, and they can't change anything, just use it. And then there's a care person or researcher who just gets that data synchronized on a platform. So that's the typical way. And we have very small fitness bands and trackers that enable that for even smaller elderly people with thin wrists. So, but that's our approach. Okay, cool.
Yeah, it's so funny because APA stands for Adapted Physical Activity, which is basically the name of the webinar. I didn't get it. So to repeat the question, Jan, maybe you could answer this question as well. If you guys have data that can tell us the impact of adapted physical activity on prehab or rehab for the patients that you guys follow.
Prehab is difficult. I don't have any data on it, and I think prehab measures are still underestimated. I mean, everyone is clear. The more fit you go into a surgery or anything, the more fit you come out of it. So that's why even surgeons do not perform a surgery in, for example, in our cardiac patients that are in a very worse condition because simply they fear that they are dying. So there's, even from the cardiovascular perspective, there's a lot of work to do to find out if even just a week prior to surgery, any kind of training or enhancing physical fitness and activity can make an important asset to the outcome of the patient. In rehab, physical adapted activity, I don't really have clear examples here, sorry.
Okay.
Maybe this is, I think they are, I don't, this adaptive physical activity as such is a I'm not so familiar with the exact scientific meaning of that, but in terms of physical activity in prevention and or rehabilitation, I believe there are a number of studies on that. I don't know if that's adapted physical activity, but just a sidekick here is before Garmin, I worked also within, like Jan, in this child physical activity promotion as such. And then those days there were both the impact of physical activity on both health, like obesity, a lack of physical activity and such, but there is a lots of research also on impact of physical activity on kids' cognitive development and learning ability and concentration ability, which is also important. And in terms of impact of physical activity, there's a huge amount of research in both medical segment on health and also in this cognitive and learning ability segment.
Yeah, I would like to ask another question to Shari. With Alessandro, especially for stroke patients where you have to track so many movements, he's like asking the question, is computer vision technology actually the answer to that? Have you tried this one?
We haven't. I think we have tried it with our research institute, and if you ask me, I think it's really important for the future. It's just that we are not there yet, or at least that's what the researchers tell me. They are never happy with any device. But it would be, for my case, doing rehabilitation via telemedicine, doing it with a camera would be the best, right? Nobody would need a device to actually track the movements, and I can specifically say how they execute the movements. So I think the benefit is so huge, and it's progressing so fast that definitely this will be super important for at-home rehabilitation in the future.
Yeah, if you guys in the audience have startups or companies in this field for computer vision, just let us know. I personally also can recommend a couple of good startups to you if you need them. So let's talk afterwards. A new question. You guys are asking so many questions. I don't have time to ask my own questions, actually. But it's okay, as long as you are happy. So the highest upvoted question right now is, and this is the question I would like to ask to Juha first. In connection to the current topic, would it be more useful to have less precise data than not having data at all?
Less precise data or no data? Well, that's a classical question. And I would say if you have bad data, it's better to have no data at all. It's my personal opinion. This is not the Garmin's official opinion, but you know that as Shari said, that there are lots of sensors on the market, and if I go to our domain is the consumer wearables, and there are lots of different kinds of brands on the market now, bringing products in the market where they have all sensors in one package. So they click, we measure this and this and this and this and this. But if the data is not reliable and relevant, what does it then affect you? Because if it's wrong data and bad data, for me as an individual, it gives me wrong guidance to do something. Then it's better that I hear my body myself, or someone tells me that you are doing something wrong. So, but it's about everything in this business. It's about trust. Trust towards our company, trust about the standards, trust about the quality, and so. Personally,
if I can add something here. I think I'm not a data specialist, but I think the trends are important. So even if you have bad data, you can have the trends if the data is being collected in the same manner.
Yeah, that's true. That's true. So really true. Depending on if you are over time, if you are making decisions for now, then. But if you are making decisions and following up trends over time, your bad data is your bad data. So you can maybe see the difference with that sensor. So that's true. So maybe it's a relative question.
Okay, thanks. Jan, I would like to ask you this question. So we're speaking about good data, bad data, data trends. What kind of time period actually makes sense if you want to find out patterns? Do we need to track patients for 1 week, 1 month, 1 year?
We track for 1 week in general, but first, I think there is no bad data, it's just how you handle data. So for example, if in general we want to have, the best thing would be a patient will track this whole life activity. In general, this is not possible because we have to give out wearables, because you need to have the same wearables to have compliant data. So you cannot, the tracking of a Garmin will work different to a tracking of a Sunto or Polar device. So you have to, for clinical research, everyone should have to have the same wearable. And we take, for example, 7 days, and this is in general for clinical research important because you have working days and weekend days, because the physical activity pattern may dramatically change within week to weekend. So it's important that we have, I would say, kind of a whole picture. And unfortunately, we know that activity will change during the seasons. So in my wish, I would have a whole year activity of a patient and could process it, but unfortunately, in most of the studies, this is not possible. So for cardiovascular research, 1 week seems a proper time frame. And in terms of handling, to mention there is no good or bad data, if a patient should in general wear the wearable the whole day, if he does not wear it in the morning, I say, it's okay, write it down, and then I can see what I make out of it. Mm-hmm. Then I can handle it. And either I trash the day completely, or I can, even with AI, in artificial intelligence, which we are working a lot currently, we can impute data sets and process the data to make it usable for research. But you just have to aware from your patient what they are really, really doing. So then you can handle also bad data.
That's a very good point, I think. So you're saying you want to make data usable for research. How about making this data usable for an individual, for the front-end user, so to speak, somebody who is wearing this wearable? So how much interpretation is necessary from the side of professionals, like doctors, physiotherapists, trainers maybe as well? And how much of this data should be just so clearly actionable that the user will not need any professional help? Shari, what do you think? Shari, can you hear us? Oh, she's frozen. Okay, I hope she's coming back now. Juha, I would like to ask you this question.
Yeah.
You understand the question I'm asking, right?
Yeah, sure. I think that relates also to the previous question of the bad or good data. So that's really true what Jan said, that because
the connection was.
Hi, Shari. So but the in terms of the data, so interpretation, in this case, for instance, Jan and his research group are interpreting data that they get wherever it comes from. It's always a difference if it's an individual or not. So for me as an individual, bad data or no data, where does it leave me? But yes, I can only see that obviously what we are doing to trying to make that data more accessible and understandable for our users, because currently there are so many data points and opportunities within one watch or generated by one watch that a normal person don't need it all, or it's not relevant. And then what we are trying to do heavily is to make it easily understandable for the person, like heart rate variability mentioned by Jan. We are utilizing that as within our stress index, and then we are combining different elements of sleep and stress and physical activity into a concept called body battery. So, the energy body resources. So, I believe, and I use this example of a good old school book. If it's a good school book with pictures and everything, you might be able to understand that yourself. But at some point, you need a teacher to tell you what's in the school book. And it's the same here. And there's an evolution going on with combining the data, making it more relevant. And so I do believe, and I hope also, that many people are able to take more responsibility of their own health if they understand, are aware of what the data means for them.
Yeah. Shari, welcome back. Can you hear us? Hello, hello.
Yes.
Shari?
Yes.
Okay, cool. So the question is, especially in the stroke research, how much data needs first professional interpretation, and how much data can be used to self-empower the patients? Where do you see this balance?
Yeah, this is kind of the box of Pandora for physicians usually, because they don't like handing over data or conclusions to patients. So it's very interesting. But there's a movement right now that doctors feel more comfortable if the patients take their own actions or understand something more. And I think the comparison with the school book is really great, because if we put meaning into data and make it understandable, it can have a big use. In stroke rehabilitation especially, it's super crucial because, you know, training and going back or training back for your old functionality to gain back the functions you lost is super difficult. It takes so much effort. And it's such a high motivator if you can see your progress and if you can understand what you're doing leads in the right direction. However, there's also one downside, because progress can be sometimes very slow in rehabilitation. So if you see a graph, for example, and it's basically not moving at all and you don't see the progress, this can also lead to quite the opposite, right? So we really need to think about, and I actually think about it a lot, how we translate the data into something that's positive and motivating instead of discouraging for the patient.
Yeah, that's a very tricky question as well. I mean, does anybody of you has an idea how to do this in an engaging way for a patient, or how do we do this with data?
I mean, you always have these gamification approaches where you put this challenge where you bring the challenge into play, where you challenge others. Yeah, do 10,000 steps, or do the next day 1,000 steps more than the others, or more steps than the average. Unfortunately, all those gamification or challenging approaches are not lasting in the long run. This is still a big problem. I mean, even in general, if I give you a wearable now, you will see the first weeks you will increase your intensity and your steps in general, because just the wearable is a kind of a nudging. You look on the watch, you see, oh, 10,000 steps, maybe tomorrow I will make more. But what comes after 2 weeks? If you're walking 30,000 steps a day, it's hard to maintain this, and yeah, then it drops down. And there's still the holy grail, how you manage to maintain this physical activity pattern. How do you bring those people that they keep active?
Okay, thanks, Jan. We have a question which is really relevant for this discussion now from Juan from Barcelona. And he's asking, like, okay, we understand we need kind of both. We need engaging interfaces, but we also need help with some professional interpretation, maybe kind of coaching, you know, so the patients don't get discouraged too fast. So how do you guys see wearables, or especially Juha, how do you see wearables manufacturers being more involved with health entities or gyms to kind of support this data interpretation coaching?
Can you repeat the first part of the question? I lost you.
Yeah, so the question is, how do you guys think we can combine, hola, Juan, yeah, hi. How do you guys think we can combine front-end engaging interfaces on the one hand, and professional coaching and interpretation on the other hand, and how can wearable manufacturers, for example, Garmin, be more involved in these health systems and gyms?
Thanks. Gracias, Juan. I think there are, you see different kinds of approaches on the market. from Apple and Fitbit and Garmin. So Garmin, as a sort of heritage of Garmin, is that, well, we focus on our best of breed hardware and that sense, and an open ecosystem. Open ecosystem meaning that it is really easy for research or the sports ecosystem or health ecosystem to integrate our devices into their specific fields, because they are the masters of their context. Like if it's a gym, if it's some kind of a specific rehabilitation or sports, they are the specialists for that. And we are working with a big number of companies that provide solutions of these kinds of different kinds of fields. And what we do is that we open, through our APIs and SDKs, we open them an opportunity to integrate our best of breed wearables into their ecosystem. And that's why how we of course see what's happening on the market and what are the requirements also for us. But I believe this is Juan, this is the key issue in the whole ecosystem, that how can you combine the best expertise for a certain field? Because at least some companies try to do everything on their own, like the Amazons or Googles, with different kind of an approach. We try to bring our part where we are very good at, and let the professionals do their part in this kind of more population health or sports related contexts.
Okay. I have another question from Anya Gochel-Kwenk. She's, I guess, from Egypt. And so she's asking, how do you guys measure success and show success to the patients to motivate them to stick to their plan? Shari, do you have an idea how to do this? Yeah, we can hear you now.
So, can you hear me now? Sorry.
Yeah.
Okay, perfect. Yeah, basically by collecting data still. Right now, this is mainly done in our clinics. So we have a motion lab where we can precisely measure the progress and then see where they still have deficits. But we still have therapists explaining this data to the patient, because it's still not in the home setting. So yeah, I think the showing progress directly to the patient is still at a very early stage for us.
Yeah, let's switch the topic a little bit. We have 10 minutes left, so if you guys have any urgent questions, that's your chance to ask them and to upvote them. But what I would like to know, because FitTech Summit is mostly taking care of the fitness wellness ecosystems, and what we see here is that with Apple Fitness Plus, for example, and connection to the Apple Watch, we're witnessing the emergence of closed health and fitness ecosystems. What kind of data ecosystems that are probably emerging do you guys see in your fields of research and work?
Go ahead, research.
Ecosystem merging, that is always big. Merging data or connecting to other APIs is still a big thing in terms of data security, which is a huge effort you have to take, especially from research perspective and from ethical approaches you have to set up at a very early stage. So in terms of research, I mean, we are hosting our data in general on-premise servers and are not connected to any other ecosystems, because this is a huge legal challenge. So in terms of research, it will become, I think, difficult to merge different data from different devices and different wearables.
Okay, Juha, but what would you say? I want you to answer this question actually, because you guys are also working on the open API. You want to create the ecosystem. You have lots of partners who are already part of the ecosystem of Garmin using the data. So what's your take on this?
Yeah, well, the Apple you mentioned, Google, Amazon, Amazon Halo. These kind of companies, obviously, the definition of ecosystem is a little different how we understand it. Sort of Apple is an own ecosystem. And by the way, Apple is doing very sort of a good work for the whole industry because, you know, with their power and everything. So maybe then as an example, and then I'll explain the Garmin approach on this. But ecosystems, how we have seen then, if you take the apples out, then the ecosystems are, it's quite interesting to see how in the different kind of national digital health ecosystems are evolving. Two high-tech oriented countries are, for instance, Israel and Finland, where it's very pragmatic, high-tech oriented, homogeneous society. And in Israel, there's even a big initiative, I think they call it Digital Health in Israel. Mm-hmm. And the key players are the health management organizations and everything. So the high tech is built around. So it's sort of a national ecosystem. And I believe that's a very good example of, if it doesn't work in all the countries because it's a specific context, but here you can really put the public authorities and the high tech in the same field, and they are working with same rules. And the other one is obviously in Finland, where sort of there's a my personal health cloud type of initiative where each person would have their own, like a bank. This is my health data, and I can share it with everything. So this is. In many countries, you can see this kind of ecosystem. The approach of Garmin is, because of our heritage, we have marine, automotive, aviation, fitness, outdoor. So we are very different of these kinds. And that's why we are sort of, from day one, everything should be connected with anything. And that's why in the health segment, our approach is to have an open ecosystem. We focus on the consumer and the user and the hardware, and then we work with the healthcare professionals, telemedicine professionals, wellness and gamification professionals who really can do that. So there are only a few companies in the world like Apple or Google who can really do that. But I think the future of healthcare and data is about the open ecosystem.
So can you tell me more about how many partners do you have in your own ecosystem, and what kind of partners are you looking for?
We don't disclose that, but I'd say thousands of partners, third-party apps, platforms, research platforms, and so forth. We are looking for everyone. And I just start from the gamification and corporate wellness because there's a huge industry in there. There are many well-working initiatives and concepts for gamification and engagement. We are always looking for them. We are also looking for telemedicine, remote monitoring partners. Obviously, research is always interesting because that we are challenged and we learn. Those are the key ones, obviously.
Mm. Yeah, that's a very interesting point that you are touching upon here, Sharon. I would like to ask you one of the last questions, because we are running out of time soon. You mentioned telemedicine, Juha, and I know, Sharon, that you have a very strong take on this, like how you see telemedicine and scalability of patient treatments and stroke rehab in the future. So how would the ideal system for cooperation between telemedicine, doctors, physiotherapists, data look like in your eyes? And where do we stand right now?
Depends on the country. So in Germany, we're still at a quite early stage for telemedicine. In other countries like Switzerland, which is quite surprising to many people, you have been using telemedicine for a long time already. I think it's a shame that we don't make enough use of telemedicine because it can actually solve one problem that we have in healthcare, namely bridging the gap between hospital and home. Mm-hmm. And connecting or allowing more care in the patient home. So hopefully in the future, we first of all have better regulations or allowing more telemedicine. For example, in rehab, telemedicine is still not allowed. It was allowed during COVID. Now it's not allowed anymore. So quite an unclear stage. and we still have no guidelines. So therapists are a bit late to the party. So physicians already realized, okay, this is important, and the medical societies brought some guidelines out. But in physical therapy, it's really early stage. It's not quite clear yet how to do therapy at home. So ideally, a patient having a stroke would get in clinic care inside the clinic, start his rehabilitation journey there, then get back to his home and have a mix of ambulant care and telemedicine, and then maybe switch to a complete telemedicine setup in the future. At least that's why I find quite useful for these patients. That's
a good scenario to me. Juha?
May I add something? And I can say that we as a company have, and the ecosystem we have noticed an huge increasing attention towards everything remote during the pandemic. So and you are maybe focusing on the, let's say, Central Europe, Germany, Switzerland, but there are many countries where this kind of remote monitoring or telemedicine is perhaps the legislation is seeing it the more pragmatic way, perhaps, than maybe in Central Europe. So there are many countries where these kind of approach is already used. But as said, I think the current pandemic it's a bad thing. But if somewhere, then we have noticed a huge increase in interest towards remote monitoring and telemedicine. And I truly believe that also in Germany that will be, having some speed, both from the public authorities as well as from the industry itself.
That's a very good closing remark. Corona is a chance for more and better telemedicine data. So guys, thanks for being with us. Thanks for listening to us. If you guys want to connect, I'm speaking to the audience now. If you want to connect to any of the speakers in the future, just drop me a line. I've posted my email in the chat. I hope you enjoyed the conversation, and we'll see you in actually 3 weeks on October 15th. We'll be talking about the data-driven approaches in gyms and about generating new revenue streams. So I hope to see you again. Have a great day and talk to you soon. Goodbye.
Thank you.
Thank
bye.
you. Bye-bye.
Bye.